I'm Dr. Lonnie Harrison. I'm with Harrison Heart Vein and Vascular Center. We're a center that specializes mostly now in vein disease. I'm an interventional cardiologist by training. I also trained in arterial vascular disease and do a lot of endovascular surgical work, and also now vein work. I've been doing vein work for many years, and our practice is about 80% vein work currently. What I want to talk about today is vein wounds. When you have a wound on your leg that won't heal, or you have a sore that won't heal, the majority of the time it's because of a vein issue. What happens is the valves in the veins that carry blood back to the heart, those valves become diseased and they don't allow blood back to the heart. When the pressure builds up in the legs to a certain point, it actually closes off a lot of the circulation in the arteries to the skin, and an ulcer can develop. A lot of times it may just be from an injury, even an insect bite or a scrape or whatever that can cause that thing not to heal, and you develop an ulcer, and over time it gets worse and maybe never heals. And in fact, over a long period of time, that ulcer can actually sit there and the DNA can be changed in that ulcer and develop into squamous cell carcinoma, a cancer. So we treat ulcerations of the legs, and we do it very well. We have about 5 to 6 wound care centers across Arkansas, a couple in Texas and a couple in Oklahoma, that send us patients that have non-healing ulcerations. What we do is we find the culprit vein that's causing the problem. We go into that vein and we strip the inside of it. We do so with Varithena foam or with laser. Varithena foam is the newest treatment. It's done without any pain whatsoever. We simply put a needle, a very tiny needle, into that vein, squirt the foam in it, and it strips the inside lining of that vein. We also look for feeder veins that feed high pressure circulation to that ulcer that keeps it from healing. Many times these are from perforator veins. So we'll carefully map out the system to see if there's any perforator veins, and if they're diseased as well, then we also treat the perforator veins with either foam or with laser. So I'm happy to see you for any wounds that you have that won't heal. Some of the wounds actually can be arterial, but usually the arterial wounds are in the feet. And in patients with peripheral arterial vascular disease, we treat those as well. But the majority of wounds, remember, are a vein issue. Many physicians and patients across the state really don't know how to treat those. They get sent to wound care centers, and the wound care centers treat those, they debride those, they wrap those, and years go by and those wounds still exist. So let us see you and give you a permanent treatment for these vein wounds.